What is diabetes mellitus?
Diabetes is a disorder in which the blood glucose levels are elevated as a result of the body's response to insulin and the body's management of insulin. The result is often an elevated blood glucose level or hyperglycemia, or a low blood sugar known as hypoglycemia. Hyperglycemia is manifested as extreme thirst, fruity breath odor, rapid thready pulse, excessive urination, skin dryness, and a blood glucose level of over 250. Hypoglycemia has symptoms that can include shakiness, tachycardia, anxiety, blurry vision, hunger, fatigue, and a blood sugar level of less than 60.
There are three main types of diabetes: type 1 and type 2, as well as gestational diabetes. Gestational diabetes is less common type, but it's manifested during pregnancy. For this presentation, we will only be focusing on type 1 and 2. Type 1 diabetes is considered an autoimmune disorder as it is a direct result of your body's response of attacking the insulin created by the pancreas. Type 1 is less common than type 2, occurring in roughly 10 to 12% of the population. Due to the major side effects of type 1 diabetes, it's normally diagnosed early in childhood. These side effects often include unexplained weight loss, excessive thirst, polyuria, excessive hunger, fatigue, and irritability. We will discuss treatment options later on in this video.
Moving on to the most common types of diabetes, 95% of diabetics are type 2. Type 2, unlike type 1, is often developed later in life as a result of lack of nutritional management, poor lifestyle choices, and is often hereditary. Type 2 diabetes is a result of the body's inability to properly manage its own insulin production. Insulin is a hormone created by the pancreas, and it acts like a key to let blood sugar into your cells. Those who have type 2 have cells that are no longer responding normally to insulin and have resulted in insulin resistance. This eventually leads to hyperglycemia. We will now discuss the treatment options for both type 1 and type 2, as well as prevention measures for type 2 diabetics.
There are various types of treatments and management when it comes to diabetes. Type 1 diabetes is often managed through continuous blood glucose monitoring and insulin administration, usually done through subcutaneous injection or via a pump. Type 2, while it usually can be treated alongside with oral anti-diabetic medications, it usually is managed through prevention measures by changes in diet and exercise. There are various types of insulin that differ in their onset of actions, peak, and durations.
Insulins range from rapid-acting, short-acting, intermediate, and long-acting. Rapid and short-acting have shorter onsets, shorter peaks, and durations than their intermediate and longer-acting counterparts. The three medications we've chosen to highlight are the rapid-acting, Humalog, the short-acting regular insulin, Novolin R, and the long-acting Lantus. Humalog, also known as the generic name Lispro, has an onset of 15 to 30 minutes, peaks within 30 to 90 minutes, and a duration of 3 to 5 hours. Novolin R, or isophane NPH, a short-acting, also known as regular insulin, is the only type of insulin that can be administered via IV with an onset of 15 minutes, peaks within 15 to 30 minutes, and a duration of 2 to 6 hours. Lastly, Lantus, or Glargine, is a long-acting insulin medication with an onset within an hour and a half, no peak, and can last up to 24 hours.
For our case study, we have chosen to highlight a patient in the following scenario. A 12-year-old is brought into the ED by her mother. The patient is more lethargic than usual, they have lost weight rapidly, and they are urinating frequently for the past month. The patient also reports feeling dehydrated despite the constant consumption of liquids. Her mother has noticed a fruity acetone smell on her daughter's breath and in her daughter's room. The patient has a family history of type 1 diabetes that runs on her father's side, and this includes her grandmother and aunt. Her maternal grandmother has type 2 diabetes. Upon assessment, the patient's blood glucose was 768 with an A1C of 13%. Physical assessment findings include Kussmaul respirations, and these are described as deep, rapid, and labored breathing, and signs of dehydration. This patient has a medical diagnosis of type 1 diabetes. This is how we would treat this patient. The following interventions would be put in place for this patient who has type 1 diabetes. They would monitor vital signs, watching for tachycardia after insulin administrations, determine blood sugar levels, and administer insulin according to a sliding scale. They would monitor the patient's A1C levels every 3 months. They would cap carbohydrate limit to manage blood sugar levels. And we would prepare a teaching plan for not only the patient but their family as well, based on their current knowledge of diabetes. We will have this patient manage their type 1 diagnosis in the following manner. They will monitor carbohydrate intake daily. They will check their blood sugar before every meal. They will report any signs of hyper or hypoglycemia after insulin administration. They will watch for interactions in drugs such as aspirin and alcohol, and they will watch out for interactions in hormones as well as smoking.
Hi everyone, my name is Sam. I am actually type 1 diabetic myself. I was diagnosed back in 2013. I was 12 years old. And I'm going to be showing you a few of the devices that I currently use to manage my diabetes. So this is called the Omnipod. This is the Omnipod Dash system. It connects to this PDM, and this is the meter that I use to check my blood sugar with. So these two communicate with each other. I input the amount of carbs that I'm going to be eating, as well as the blood glucose reading, and it does the math for me. And it calculates a precise bolus to give myself via the insulin pump before any meal. So this is a tubeless insulin pump, so it does not have the external tubing that other pumps have. It makes it easy to maneuver and do different things without having to worry about your tubing getting caught in furniture. And this will hold up to 200 units of insulin, and it lasts about 3 days. And you would just normally put it wherever you would do injections. I wear mine on my abdomen. And yeah, it's great. Makes living with diabetes a lot easier. And here I have the Dexcom G6. This is the sensor. This is how you would apply this sensor. So it kind of looks like a little mouse. You would just put it on your arm, abdomen, and so it has a transmitter that you would insert. So this is my Dexcom. And this, what it does, it checks your blood sugar every 5 minutes, and it keeps track of it in a graph, and it can connect to your phone so that you can keep track of your blood glucose readings throughout the day. It lasts up to 10 days, and you can track any abnormal patterns that you would have in your blood glucose. Let's say if you're running high all the time at night, you can make adjustments to your insulin pump, and during that nighttime period, it'll either up the insulin dose that you get to bring that blood sugar back down, to decrease the amount of times that you are getting high glucose readings at night, or if it's the opposite scenario where you're getting too many lows, then you can decrease the amount of insulin between, let's say, 12 a.m. to 6 a.m., like the times that you are sleeping. So yeah, so these are the different devices that I use, and I also use Humalog for my insulin pump. The insulin pump will only use rapid acting, and these devices can be used for both type 1 and type 2 diabetics, and there's no need for a long acting insulin, so there's no need for Lantus, and that's another insulin that I would use prior to being on an insulin pump, because this is already administering insulin constantly throughout the day. The only extra insulin that you would get is when you bolus for meals, or do any corrections to your blood glucose. So yeah, I hope you guys enjoy this demonstration.